Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program. Listen in and learn about the exciting advances in hearing loss treatment. Technology is making the ability to hear better and better. And in this edition of Helping Seniors TV, Helping Seniors TV program host and longtime senior advocate Joe Steckler talks with Dr. Karen Cowan-Oberbeck and Glenn Oberbeck of Ear Care PA, with locations in Melbourne, Merritt Island, and Indian Harbor Beach.
Welcome to this edition of Helping Seniors. Our program today is about ear care, hearing loss. It's hearing loss, but my panelists are from ear care. So I kind of confused my audience a little bit there, but the company is Ear Care, and you have 3 locations in Brevard County.
Correct.
And Dr. Cowan-Oberbeck,
Cowan-Oberbeck, yes.
You are the audiologist,
That's
and
correct.
you, Glenn Oberbeck, are the
Board
certified hearing aid specialist.
Correct.
I got it right.
Yes, sir.
Okay. What this means is you do everything that Karen doesn't do.
I try.
You know, folks, we can joke about it all we want, but hearing loss is a tremendous thing to overcome. And do either one of you wearing hearing aids?
I wear
You do?
I had some acoustic trauma in my left ear from a blast in 1986, and I've had hearing loss in my left ear only since then.
I didn't even see that rask on your ear.
The advantage is I get to play with all the new technology and make sure that they work and how they work.
Well, after the show, I'll get you to tell me if mine are as good as yours. But I don't know. I can hear out of them sometimes I can't.
We didn't fit those hearing aids.
Pardon?
We didn't fit those hearing aids.
No, you didn't fit the hearing aids. But before we even get into our script today, one of the biggest disadvantages those of us that wear hearing aids have is distinguishing between accents when somebody is talking. And perhaps you might talk about that a minute for our viewing. You know, people will say, well, gee, why doesn't Dad hear me? Or why doesn't he understand what I'm saying? Or somebody says at church, why couldn't you understand the priest when he was giving his homily? Why don't they?
Well, the problem with hearing loss is it's usually not all or nothing. Hearing loss creates sound voids or gaps in your hearing. So there's pieces and parts that you hear and pieces and parts that you don't hear.
Okay.
And so that in itself is a struggle even with English, with a language you are familiar with. If you add different nuances of different languages that have different sound qualities and different sound properties, that just adds another dimension to those voids, to those gaps. So plus it makes a difference in how fast people speak. Again, going back to those voids or gaps in your hearing, keep in mind your ears are just sending information to your brain. It's really your brain that's doing all the sorting and organizing of that sound. So if we send the brain better information, it just works better. But again, adding speed to speech, adding accents to speech, adding background noise to speech, all those things contribute to making it more difficult, not to hear, but to understand.
That's what I was saying. I can hear, but I can't understand a lot of it. And that's the thing. Do you have the same problem?
So I have the ability to process normally in my right ear. My left ear does have hearing loss, but I also have good discrimination. That's the ability to process the words as I hear them. One of the big difficulties that we face with patients that have moderate to severe hearing loss is that we may be able to get them the sounds back, but they're not able to process those sounds because of the discrimination or ability to understand those sounds. And that's where clarity and proper fit and validation are key factors to give you the best results possible. So It's not all about volume. Clarity is a real key issue. And processing.
Yeah, comprehension, and I've had different audiologists tell me that consonants are so hard for many people to understand.
Those are typically high frequency sounds, and that's where most people's hearing loss starts, is usually in those high frequencies.
That's where it starts?
So
I've got a granddaughter that I had her repeat one word over a telephone to me 8 times before I understood, and then she finally spelled it for me, and I finally got it.
Or if you use it if it's a specific word, if you put it in a sentence, now you've given your brain some more information to go, okay, what word makes sense now that you have a little bit more to
Help you
work
understand
with.
it, like
Right.
lip reading.
That too, yeah.
Okay.
So anytime you can be face to face with someone, you're getting more information because you can see the difference between different sounds on your face. And it also helps if I slow down when I speak to you, because again, your poor brain, back to your brain, is trying to fill in all those missing pieces. And if I talk too fast,
Yeah.
your brain doesn't have a chance to catch up and fill them in. So if I slow down, it gives your brain that opportunity to
That's
catch
the
up.
same thing I experience when I try to listen to the people that have different accents. I try to catch up. What are some of the really signs of hearing loss? If you, what are the?
Well, you already mentioned one of them is missing pieces and parts of things. And again, it's not usually all or nothing. And very, very often it's the people around you that are noticing those things before you are, because they're the ones that are having to repeat things, or they're having to say things over and over again. If the birds chirping disappear, you may not notice that right away. It's usually communication issues where someone's tried to speak to you, maybe from the next room or in a noisy place. And that's what you'll find, is that you heard what they said, but you didn't quite get it.
I can hear the sound, but like if my wife talks to me from another room, I can hear the sound, but I can't understand it. And understanding the television is one of the hardest. Even with TV ears, I really couldn't understand it with TV ears. But with the hearing aids I have now, I can do a much better job. Yeah.
Well, TV waits for no one, so the sound is carrying on. And typically with most shows now, they not only have someone speaking, but they have background music, they have sound effects, they have all kinds of other sounds that complicate picking out the speech that you might want to hear.
Some of the advantages to today's hearing aids is consider that you have a headset on with TV ears. That is not a corrected amplification. So if you have a proper fit pair of hearing aids, we have TV transmitters now that can transmit directly into the hearing aid without any intermediate device. When that signal is delivered, that's at a corrected level for your hearing loss. So the clarity is much better.
So if a person suspects they have hearing loss, just from an audiologist and a technician viewpoint, what should people do that I really don't think I'm hearing as well? What should they do?
Well, the very first thing they should do is have a hearing test, and it should be by an audiologist, a doctor of audiology, who can do a full diagnostic exam and not only tell if they have hearing loss, but if there's any medical issues that may be contributing to that. It might be something as simple as too much wax in the ear. But that's generally your first step. If you're over 50, it's probably a real good idea to include a hearing test as part of your overall health regimen. Ears kind of get overlooked sometimes until something goes wrong, but if you think about it, you get your blood work done, you have your heart checked, your eyes checked. It's a good idea to make a hearing check as part of your...
It's your check.
Yes.
I had
at least establish a baseline.
Well, what you said, what talks about wax in the ear, I can remember one time when I had my hearing aids from the VA, and I still couldn't hear. So I went back out to the office. I said, I still can't hear. She said, did they check you for this, Joe? I said, no. She said, let me check. So she took the hearing aids out and went way up in my ears and found wax way up in the ear. And is there a place way up in the ear where there's a lot of hair up in the ear? And that wax is harder to detect. And I think probably only an audiologist could detect that.
Well, everybody's ears are a little different. They're like a fingerprint. Every single ear canal is different. So you may just be curvy and have a spot that's tucked around the corner that unless someone really took a good look, they might have missed.
So you couldn't get that wax out, cleaning it yourself?
Not yourself. There are ways to do it yourself. They do sell over the product earwax softeners. They're called Debrox, whereas you'll put the drops in the ear. We recommend they pack it with cotton and sleep with it overnight, but then you're going to have to flush it out the next morning. Chances are people that use Q-tips, when they try to clean the ears out, they're actually pushing it deeper and deeper and deeper into the ear canal until the point where it gets impacted. Once it's impacted, then it's very difficult to get out. So it's better to not use the Q-tips, have your ears checked and cleaned by a professional, and make sure that you don't do any damage.
And if you're a very vigorous Q-tip user, what you're actually doing is stimulating those little wax glands to make more wax. So it is kind of a self-defeating process.
I've never had anybody explain that before. Now, I can remember aboard ship that the doctors would have a tray they put up by your ear, and they used the syringe and they would flush your ears out with warm water and soap, I guess it was. But you're saying if you do that incorrectly, you could force the wax farther into the ear.
That's correct.
Good. And that's only safe to do if you have a solid eardrum. So if you have a hole in your eardrum, you don't want to be shooting water in your ears because you could be forcing it somewhere it really doesn't belong and then have a bigger issue. So really it makes a lot more sense to have someone that can look in and see what they're doing.
And that's what an audiologist does.
And
The
yes,
technician does. Is it possible that somebody could have a hole in their eardrum and not know it?
absolutely. So that's another reason it makes sense to have someone look in there and see what's going on.
Why? Okay. Nobody's ever said that. I've never heard that before either. And I do a lot of this radio and television stuff, but I've never had I never have had that explained to me either. And I've had hearing aids for years. So you're saying that a person could have, if you have a hole in your eardrum, what would be an indication that you might have a hole in your eardrum? How do you know that?
Usually it's, if you've got a hole in the eardrum, it can be from a traumatic event, or it can be from a spontaneous middle ear infection that causes the tympanic membrane, the eardrum, to have perforation. You would know that because of the pain involved. There's usually history involved with patients that have perforated eardrums, but also people can go undiagnosed. So it's important that if you're going to be doing a visual inspection, to always ensure that the eardrum is intact before you do any flushing or any manipulation.
So let's say if a person goes in and says, I really don't think I can hear well. I might need hearing aids. And you look at that person and you determine that they do have a hole in the eardrum, as long as other problems. When you adjust their hearing levels, can you adjust for the hole in the eardrum?
It's a good question. Most people that have perforations in their eardrum have that's going to only associate for a minor difference in their hearing loss. Perforated eardrums, people live every day with them and they do fine. People have tubes in their ears to allow the pressure in the middle ear to equalize. They live with that and they do fine. To adjust for a hearing loss, it's really only going to be a small amount of volume that they'll be missing because of the perforation. It's pretty interesting because the eardrum is actually what's vibrating to send the stimulus to the cochlea to be able to hear. So the perforation is not that big of a deficit historically.
it's more of a medical issue that you just want to keep it clean and dry. So you don't want to get water in the ear.
Okay. All right. We have estate plans. We have financial plans. We have medical plans. We have dental plans. Why don't we have ear plans? Or do we have ear plans? Or what do you recommend that somebody, what would you recommend, both of you recommend from an audiologist and a technician point, what would you recommend that the people watching this show, what do you think they should do in order to develop a sound, logical ear care plan that they could follow? What should they do?
Great question. So as far as the financial end of it, most hearing aids are out of pocket. We're seeing more and more third-party insurances that are able to cover or provide assistance for purchasing hearing aids. There's also capability of Care Credit, which is a medical credit card that you can actually use many times with 0% interest. So there are financial assistance available in some cases. Most insurance do not pay for hearing aids. We're seeing more insurance companies get on board to assist with the purchasing of hearing aids. Now, because it is a medical device, it is tax deductible as such. So we reinforce that and educate our patients so that they're aware of that. First order of business is to identify if you do have the hearing loss. Once you identify that, then you have to figure out what is your best selection as far as technology, style, performance, and budget. Budget is a key factor. The real issue that you want to consider when getting into hearing healthcare is that once you're in the system, it's not going to go away. It's something you'll be dealing with the rest of your life. So you want a maintenance plan and fitting strategy that's going to last you many years, if not the rest of your life. So it's really important to establish that relationship.
Yeah, but if you go into your primary care doctor and he takes the thing, turns the flashlight on and sticks that little probe in your ear, and it goes in your ear about that far. That doesn't tell you anything up in there, does it?
It tells you what's going on up to the eardrum, because that's as far as he can see. Unfortunately, about 3/4 of your ear is beyond that eardrum.
And so what do you do, Doctor?
And that's where testing is helpful, because the testing that I do gives the doctor or the ear, nose, and throat physician or ourselves information about what's going on beyond the eardrum and how that ear is performing. Short of doing an MRI or a CAT scan, which would show if you had a physical growth or some other anomaly, the hearing test itself actually gives the diagnosis as to how that ear is performing, what it's capable of, and what's going on back there.
But let's just say if you sit the person down in your chair and you take all the things that you can use to check, you can, from what I hear Glenn say, is that there are a lot of, and you too, there are things that you can fix that don't necessarily require hearing aids if an ear has not been cleaned properly. And I would say probably you find a lot of wax buildup that is impacting hearing in a majority of people. And they'll never know that unless they go to an audiologist.
And have someone take a look.
And what?
And have someone take a look.
Right.
That knows what they're looking at.
But the primary care doctor does not look for that.
Sometimes they should be looking for that. Oftentimes they'll do a flushing right in their office. Each primary care physician has their own policy with that. Some refer out immediately. Some like to take care of what they can themselves.
It's really important when you do the testing that you qualify that test as accurate. When we do testing, I should say when Karen does testing, we identify how the sound is going to the eardrum. We identify how the middle ear is processing and conducting those sounds from the eardrum. And then we test how the cochlear is working and processing the sounds. We have multiple test banks to identify if there's a breakdown in that sound transfer, where that's happening. Key issue is medical referral, as you mentioned. We identify if there is a medical capability of correcting or if there's not. If there is, it's important that they follow up with their medical doctor, and it should be a referral service.
Okay, now, both of you have mentioned a word it's called the cochlear.
Cochlea is the inner ear. There's three major parts to your ear. There's the outer ear, which is what I can see when I look in there. The middle ear is the space behind your eardrum where you may have had some fluid when you had a cold, or your ears pop on the airplane. That relates to the middle ear. And then the inner ear connects to the nerve of hearing and to the brain, and that's also where your balance mechanism is connected. So the testing does basically a rule out as to which part of the ear, or maybe multiple parts of the ear, that are contributing to the difficulty with hearing.
When I was a young man, had a cyst on the inner ear. I had to drive across country. It was after I graduated from the Naval Academy. I got to San Diego, and the doctor looked in there, and had to be an audiologist, because she said, the only thing I can do is lance it. And she said, I can give you nothing for the pain. Am I being true?
Probably didn't feel so good.
Yeah.
But it felt better afterwards.
And she said, if I didn't, she says, I can't tell if I'm getting into an area that I shouldn't be touching. And she said, I counted them. 17 pricks with that probe before she got that thing lanced. I thought I was going to go crazy.
That would be external canal. Anytime you go in the middle ear or inner, you have to go surgically. So for a lancing of that caliber, it would be extremely painful if they didn't use a local anesthetic. The ear canal itself, you may know, is very sensitive, and any manipulation can be extremely painful. So you want somebody that's qualified, that has experience.
That knows what they're doing.
Yes, sir.
Yeah.
Now, I've heard the expression cochlear implant. And what is that? And is this something that you do? Do you do that?
No, that's absolutely a surgical procedure. And that's not even something, with all due respect to our local physicians, that I would recommend that you do locally. Typically, if you have a cochlear implant, that's a major invasive procedure. And that's typically done here in Florida at major medical centers. So at Mayo Clinic, at Shands, up at Gainesville, University of Miami are typically places we recommend that they're doing these procedures every day. They're very proficient at them. So
Well, how often is that something that impact your hearing, the cochlear? Or is that something that, what is the importance of understanding? I've heard it bandied about so many times with different people.
the cochlea itself is
Yes.
the inner ear. That's your organ of hearing.
Okay.
So most people that have hearing loss have some damage to their little hair cell receptors that are inside the cochlea. People that are getting cochlear implants at this stage have very damaged cochleas.
Okay.
So because when they put the probe in for the cochlear implant, they're actually wiping out your inner ear. So if you had a lot of residual hearing, that wouldn't be very ethical to go and wipe out what
Wow.
hearing you had left. So that procedure at this point is only for people that have very severe hearing loss.
Okay. Okay. We're probably talking about some things that a general viewer would never even hear about, or are we? Are these something that's becoming more
Cochlear
common?
implants are becoming much more the standard of care now, especially for folks that have lost hearing. Amongst the deaf community, and that's a whole other issue, they're not completely supportive of cochlear implants. But folks that have had hearing and have lost it, it's been a miraculous thing.
Oh, I imagine it would be. And until you have a hearing loss, you don't. Other people that don't have a hearing problem cannot understand the degree of difficulty those of us that have a hearing loss are facing. It's just, I know it frustrates my children that I can't understand them, but I'm just as equally frustrated that I can't understand them either.
That's one of the bigger issues that we deal with is people, they expect their hearing to be corrected back to normal. And it can't be if the damage is too far gone. So you only have what you have to work with. And it's not like a typical handicap where somebody has vision issues or they have a cane. You look perfectly healthy. You have hearing aids. Why aren't you hearing me? That's the frustration as far as the hearing aid user we find the biggest difficulty with. Hearing aids are an assistive device. They are there to help. They don't correct like vision. It's going to work with what you have left or remaining in the nerves to be able to help you stimulate to get better clarity. That's the biggest frustration we face, is that we want to help people hear as best as possible, but we can only improve on what we have to work with. And that's the biggest challenge.
But given anything all equal, if a person comes to you early on and says, I think I have a hearing problem, then with what we have available today, with all the tests and everything that you can do and the devices that you've seen, two questions. What are the benefits of coming in like that early on, and what can hearing aids do under current state-of-art development? What can they do to help people improve their hearing? And then maybe from a technical viewpoint, what do you see coming down the pike that might help people in the future? Sort of a double question. Please, both of you answer that.
Well, I would say certainly with hearing loss, sooner is better than later. And the reason is what Glenn alluded to before. Hearing aids can only work with what hearing you have left. So if you wait till your hearing is very badly diminished, hearing aids may not even be of assistance to you at that point. So sooner is better because you've still got some hearing to work with.
Okay.
The hearing aid's going to stimulate your ear, which in turn stimulates your brain. And really, it's ultimately about your brain. So if we send the brain better information, the brain's going to work better. So sooner is always better with hearing aids.
Okay. Glenn, what is a technician? What do you see?
The technical aspect of assistive listening is that biggest complaint for patients is when they get into noise. Speech and noise is always going to be a challenge because hearing aids are designed to amplify speech. Well, when you get into a background environment and the speech is multiple patterns of speech, The hearing aid does not have the ability to say, I want to hear person A and C, but not B. And it all has to do with the microphone polar pattern. So the hearing aid is going to amplify the speech within that pattern to input so that you can hear them. Some of the advantages to today's technology is what we call adaptive microphone patterns, and the hearing aid in real time has the ability to identify with source of speech and target of the speech within a certain parameter so that you can focus better and understand the words. But there's always going to be a challenge when you're dealing with multiple input of speech environment. Some of the best advantages we're seeing today are direct audio input. So for the patient that has extreme hearing or very difficult hearing in noisy environments, they tend to not go to restaurants a lot because they can't have interaction with people they want to sit with. So if the hearing loss is that bad, we do have multiple capability with microphones that, let's say, a partner or a friend could wear, and they just simply press a channel on their device or a button, and it allows them to get the direct audio input right from the microphone into the hearing aids, reducing any of the noise in the environment so they can have that conversation without all of the background noise. Advantages that we're seeing coming down in the future, the technology in the hearing aids today is very active. We're seeing more and more capability of the hearing aids to filter out unwanted sounds and focus on speech more clearly. It's not good enough. Hopefully that we're going to see bigger changes in the future because it is a big challenge, not just for me as a person fitting the devices, but for the patient that's wearing them. So direct audio input, whether it be through a system that's in the church that allows them to stream directly into the hearing aids, theaters, telephone, a lot of advantages.
Okay. Well, we're out of time. We'll be back again, though, but I want to thank you, Dr. Karen, and you, Glenn, for being here today. It's always enjoyable to hear something that pertains to me, too, so I like to hear it. And thank you, viewer, for watching this episode of Helping Seniors. We'll be back again in the future. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.